Assalamu alaikum my dear students. Today I will tell you about the differences between the skeletal, smooth and the cardiac muscles. So I would be filling the table alongside and you would be following it. So let's start with the resting membrane potential. So resting membrane potential in the case of skeletal muscle is minus 70 millivolts. In the case of smooth muscles it is minus 60 millivolts. And in the case of cardiac muscle it is minus 90 millivolts. Now talking about the threshold value. In the case of skeletal muscle, it is minus 50 millivolts. In the case of smooth, it is minus 30. Some cases it is also minus 20 millivolts, but normally it is minus 30 millivolts. And in the case of cardiac muscles, we have minus 70 millivolts threshold. This means that the stimulus must need to reach these values in order to generate the action potential. Now talking about the plateau phase. So plateau phase is not present in the skeletal muscles. It is not present in skeletal muscles. Talking about the smooth muscles, plateau phase is present. And if we talk about the cardiac muscles, yes, plateau phase is present. Now talking about the bell-shaped graph. So bell-shaped graph, yes, these are for the skeletal muscle. But no bell-shaped graphs are found for the smooth and cardiac muscles. So we will write no for both of these. Cause of depolarization in the skeletal muscles are the sodium gated channels. Sodium gated channels. And the cause of depolarization for the smooth muscles are the calcium gated channels. And the cause of depolarization for the cardiac muscles are the sodium gated channels. Now talking about the amount of sodium channels in three muscles. Let's drag down this particular so that we can see the download information. Yes. Now talking about the amount of sodium channels. So amount of sodium channels in the skeletal muscles are large. If we talk about the smooth muscles, these are less. And amount of sodium channels in the cardiac muscles are moderate. Now talking about the what is the cause of repolarization in three of these muscles. So cause of repolarization are the outflux of the potassium ions. So these are same. So cause of repolarization in three of muscles is same. That is the outflux of potassium ions through potassium channels. And we will write the same here, because in three of muscles the cause of repolarization is the outflux of potassium ions, because when potassium ions would move out, what would happen that there would be a restoration of the resting membrane potential. Now talking about the calcium channels involved, so we have no calcium channel involved in the skeletal muscles, but calcium channels are involved in the case of both smooth and the cardiac muscles. Now talking about the transient potassium channels, so no transient potassium channels are found in the skeletal muscles, and also no transient potassium channels are found in the smooth muscles as well, but transient potassium channels are found for the cardiac muscles. So this is the complete table. You must need to remember these values and hope this would find very useful for you. Thank you.